Coughing in children is a common symptom and can range from a mild annoyance to a sign of a serious medical condition. To understand and address it effectively, it's essential to know why coughing happens, its potential causes, and how to manage it. Here is a detailed explanation based on reliable medical insights. What is coughing and why does it happen? Coughing is the body's natural reflex to clear the airways of mucus, irritants, or foreign objects. It is a protective mechanism triggered by sensors in the throat, airways, or lungs when they detect an issue. Dry cough, no mucus is produced, often associated with irritation or allergies. Wet, productive cough produces mucus or phlegm, commonly seen in infections or conditions affecting the lungs. Main causes of cough in children. 1. Infections. Most childhood coughs are caused by infections, which can be viral or bacterial. Common cold and flu symptoms include a runny nose, sneezing, mild fever, sore throat, and a cough that may last 1 to 2 weeks. The cause is viruses like rhinovirus or influenza. Treatment involves supportive care like rest, fluids, and fever control. Croup symptoms include a barking cough, hoarse voice, and noisy breathing or stridor. The cause is a viral infection that inflames the upper airway. Treatment includes humidified air and steroids if severe. Pneumonia. Pneumonia is a lung infection. It can happen when germs like bacteria or viruses spread deep into the lungs. Symptoms include a strong wet cough, fast breathing, chest pain, and fever. Treatment involves antibiotics for bacterial pneumonia and supportive care for viral. Whooping cough or pertussis. Symptoms include severe coughing fits with a whooping sound and vomiting after coughing. The cause is a bacterial infection, Bordetella pertussis. Prevention is through vaccination, specifically the DTaP vaccine. Treatment involves antibiotics to prevent spread and complications. 2. Asthma. Asthma is a chronic condition where the airways become inflamed and narrow. Symptoms include a persistent dry cough, wheezing, shortness of breath, and symptoms that are worse at night or after exercise. Triggers can be allergens, exercise, cold air, or respiratory infections. Treatment includes inhalers like bronchodilators and steroids, avoiding triggers, and monitoring. 3. Allergies or environmental irritants. Chronic coughs without infection can be due to exposure to allergens or irritants like dust, pollen, mold, or pet dander. Smoke, pollution, or strong odors can also be triggers. Symptoms often include sneezing, a runny nose, and itchy eyes. Treatment involves identifying and avoiding triggers and using antihistamines or nasal sprays. 4. Gastroesophageal reflux disease or GERD. In GERD, stomach acid flows back into the throat, irritating it. Symptoms include a dry cough, hoarseness, sore throat, or frequent spitting up in infants. Triggers can be certain foods, overeating, or lying down after eating. Treatment involves dietary changes, elevating the child's head during sleep, and sometimes medications. 5. Foreign object aspiration. Young children may accidentally inhale small objects like food, beads, or toys, leading to a sudden cough. Symptoms include sudden choking, difficulty breathing, and a persistent cough. Treatment requires immediate medical attention to remove the object. 6. Chronic conditions. Cystic fibrosis is a genetic condition causing thick mucus production, leading to a persistent wet cough. Bronchiectasis involves damage to airways causing chronic mucus buildup and a wet cough. Types of cough and what they mean. Barking cough, often due to croup or tracheal inflammation. Whooping cough, characteristic of pertussis infection. Dry nighttime cough, associated with asthma or GERD. Chronic wet cough, suggests conditions like bronchiectasis or cystic fibrosis. When to worry about a child's cough. You should consult a doctor if 1. The child has difficulty breathing or wheezing. 2. The cough lasts more than 3 weeks. 3. There is a high fever above 39 degrees Celsius or 102 degrees Fahrenheit, or a persistent fever. 4. The child is coughing up blood. 5. The cough started suddenly, suggesting the child inhaled a foreign object. And 6. The child is under 3 months old and coughing, as their immune system is still developing. How to manage cough at home. First, hydration. Give plenty of fluids to thin mucus and soothe the throat. Warm drinks like herbal teas, if age-appropriate, can be soothing. Second, use a humidifier. Moist air can ease breathing and reduce throat irritation. Third, honey for cough relief. For children over 1 year old, honey can help soothe the throat. But avoid honey in children under 1 year due to the risk of botulism. Fourth, positioning. Keep the child upright to help with breathing. Fifth, rest. Ensure the child gets enough rest to recover from infections. And finally, avoid irritants. Keep the child away from smoke, strong smells, and allergens. Medical treatment options. Antibiotics, only for bacterial infections like pneumonia or whooping cough. Inhalers or nebulizers, for asthma or severe respiratory distress. Steroids, for croup or severe asthma attacks. Antihistamines, for allergies causing chronic cough. Prevention tips. Vaccinations. Ensure your child is up to date on vaccines, especially for pertussis and flu. Hygiene. Teach frequent hand washing to reduce infections. Avoid smoke. Secondhand smoke increases the risk of respiratory issues. As parents, it's natural to want to help your child feel better quickly when they have a cough. However, it's important to know that sometimes not treating the cough directly is the best approach. Here's why. 1. Cough is the body's natural defense. A cough is not always something that needs to be fixed. Purpose of a cough. It helps clear mucus, germs, or irritants from the airways, protecting the lungs. Suppressing a useful cough. If you stop a cough too soon, for example, using cough medicines, mucus or germs might stay in the lungs longer, potentially worsening the problem. Example: in cases like the common cold, a cough helps remove mucus caused by the infection. Suppressing it could delay recovery. 2. Risks of overtreating with medications. Many over-the-counter cough medicines are not recommended for children, especially under 6 years old, because they don't always work. Studies show that many cough medicines don't effectively reduce coughing in children. They can cause side effects. Some medicines can cause drowsiness, upset stomach, or allergic reactions. Accidental overdose. Using multiple medications can lead to too much of the same ingredient, which can be harmful. Better alternative. Simple home remedies like honey for children over 1 year or warm drinks can soothe the throat without risks. 3. Treating the wrong cause. Parents might assume all coughs need the same treatment, but coughs have many causes. If the cough is due to a virus, antibiotics won't help and could cause unnecessary side effects. Giving asthma medications to a child without asthma can cause unwanted reactions and won't relieve the cough. When doing nothing is better. In cases of mild viral infections, the best treatment is often to provide comfort, hydration, and time for the body to heal naturally. 4. Invasive tests or treatments can be unnecessary. In some cases, a persistent cough might lead to invasive procedures like X-rays or blood tests when they aren't always needed. Doctors generally reserve these for specific cases, like severe or unexplained coughs, concerns about pneumonia, or another serious condition. For most children with mild symptoms, observation and simple care at home are enough. 5. Exceptions. When to act quickly. While doing less is often better, there are times when you should take immediate action. If your child is struggling to breathe, wheezing, or their lips turn blue. If they are coughing up blood or have a fever lasting more than a few days. If the cough started suddenly after choking or inhaling a foreign object. A cough is often a sign the body is doing its job to heal. For most mild illnesses, providing comfort, fluids, and rest is all that's needed. Acting too quickly with medications or unnecessary treatments can sometimes cause more harm than good. If you're ever unsure, check with your doctor to understand what's best for your child's specific situation.